alguna de las opciones al momento de hablar, ya que esto permitirá una mejor interpretación. Al finalizar el video, les pedimos el favor de hacer silencio durante 30 segundos. Una vez finalizado ese tiempo, el moderador o conductor puede iniciar la reunión.
Perfecto. Buenos días. Muchísimas gracias a todos por su presencia, por su participación. Les doy la más cordial bienvenida a este nuevo webinar sobre el enfoque de una salud en la prevención
in preventing the screwworm, the cattle screwworm. Okay, on behalf of Dr. Diego Montenegro Ernest, our representative in Mexico, in AICA, Mexico, I thank you for your participation. We have 115 participants now. I have I type a message in the chat box for you to help us sharing your name, your position, your country, institution, email if you wish. The last one is optional. But at least your name, position, and country of origin and the institution you belong to. And this is for metrics purposes. Okay, I do not see. Good morning, Alejandra. Ms. Alejandra Diaz will talk about the regional program of AICA IFES on this effort of prevention, control, and eradication of the myiasis caused by the cattle screwworm. Go ahead, Alejandra Diaz. She is the regional coordinator for Mexico and Central America in this effort where AICA, with the support of Good Use IFES, is conducting these prevention activities. Go ahead, Ingeniera, floor is yours. Thank you, Rocio. Could you tell me if you can see my presentation? Yes, we can.
Yo no te escucho, pero no sé si los demás sí te escuchan, Alejandra.
Yes, we can hear her.
Ahora sí, por favor.
Yes, we can hear you.
¿Me confirman si me pueden escuchar?
Yes, we are confirming. We can hear you.
Adelante, Alejandra. Buenos días.
Go ahead, Alejandra. Good morning.
Un momento.
Just hold on.
Ok. Ok, ¿y pueden ver la presentación?
Can you see the presentation?
Okay.
Yes, we can.
Muchas gracias, Rocío.
Thank you, Rocio. Greetings, everyone. In this important seminar,
Creo que
I believe that the One Health approach needs to be highlighted in any prevention, control, and eradication of the cattle screwworm activities. Particularly, I'm going to take a couple of minutes to give you some background and the development of a series of training and communication activities. This is a 2 year project, and particularly it is focused in training and communication. In other terms, it provides a contribution to the efforts conducted by countries at the national and regional level. Those are the Central American countries where we are cooperating, as well as with Mexico. Particularly, it has 3 goals. We work based on these 3 objectives. The first one is related to work with capacity building, and there we have a series of audience or target audience to take care of, including producers, extensionists, and communicators. Objective number 2 is about the generation of information resources. I mean, any aspect of posters, trifolios, or material that have to accompany the training process, and proactively in aspects related to risk communication. And objective number 3, we have included any aspect related to the dissemination by radio, social media, and communication campaigns that are taking place in many countries. From the preventive perspective, for example, if they do not have the screwworm in the country or related to control activities. As indicated, each country has stated an action plan, therefore, it is linked to national actions. And in some aspects, because we are seeing that it has a cross-border characteristic, we need to work with regional actions. To do so, we have a series of activities as well, like the one being developed today with under the Mexico's initiative, but with a regional and hemispheric scope or reach. Why do we give particular importance to training and communication? Well, we consider that it is a comprehensive part of prevention, control, and eradication measures. Therefore, the work we carry out with risk communication is to mediate the technical information that exists from risk managers for us to reach the population through different audiences and to generate the behavioral changes to generate this contribution, this effective contribution, and the role each stakeholder has to play in this fight against the screwworm. This is a conceptual element that we stated, and they mark our task, and they also support today's seminar. What is the screwworm? Very important statement, because depending on the perspective or depending on the competition or the discipline, this issue is addressed, we will see messages saying that it is a pest. Some people indicate that it is a disease, that it is a parasite, not only worms. So for us, yes, it is a parasite of a mammal's parasite, including animals. It is a parasite when it is on the larva phase. The treatment provided and our campaigns, communication and training campaigns are linked to this important definition that is given by WHO. However, when we state this definition, when we propose this definition and we understand it, including when adding the human aspect into the concept, we understand that because of the screwworm, there's going to be a lot of zoonotic implications. So we are addressing this point already. This point displaces the interest only on the side of animal health, but also paying attention to the human aspect, particularly understanding particularly that there are environmental conditions that may impact or not the dissemination or affecting the life cycle of the screwworm. Therefore, this is our strength, to say so, and part of the core element of this webinar, that we have this One Health approach. With this One Health approach, there is an invitation to have an interdisciplinary task. This calls on different sectors, not only at the public sector level, but also at the private sector level. And of course, the challenges are in terms of coordination. This is the basis of our task, because we consider that we need to work on a cooperative manner We need to work in teams and the different regional and international organizations as well. And if we are looking for this transformation by means of training, we are generating knowledge, but we are also looking to establish belief systems to this audience in order to succeed with the transformation, to achieve these behavioral changes. Likewise, with communication, the aim is that the understanding be a common understanding. That we do not generate panic and that the information reaches appropriately, avoiding removing myths and the lack of information. Let me go very quickly to the products and activities we have contributed to the date, along with different countries that participate in the project, but also linked to these objectives I mentioned at the beginning. Particularly for the first objective, which is training itself, we have emphasized our participation at the level of vulnerable areas, rural areas, because we need to understand that there are hygiene situations that may be favoring the presence of some wounds or lack of sanitation at the human level. So we need to get to these areas with more information. Risk training and communication has been highlighted at the level of institutional communicators, country representatives, also to those responsible parties of the training aspects. And we are even working on a virtual course, initial guidance, but with a course to train informers. It is not recent this. There have been efforts in the region in order to eradicate this disease, and therefore we should collect a lot of the experience obtained through activities that took place 2 or 3 decades ago. However, conditions are quite different. On the side of communication, we can say that we need to use the advantages information and communication technologies gives us now. So we're working on a virtual encounter to massify even more the messages, the key messages as we call them. This is a sample of the different tasks carried out by the countries. I mentioned particularly with some audience such as indigenous people in this encounter in Costa Rica, in El Salvador, working hard not only with producers but also with the police officers and even with members of the army. This is not our first webinar. We have had some others, particularly conversations promoted by Mexico for cattlemen or producers in other countries that already have this disease, share from in their own terms, in their own experience, how they deal with and what is it that they are doing in their farms, in their organizations, and in their countries to fight against this worm. So we are providing the feedback to the process because we obtain many elements of interest that help us to make adjustments to our campaigns, training campaigns, as well as communication campaigns. We consider it important to have a conversation for the media. We have held this in Panama already, but as long as we need it, we will continue doing this. And upon the request of the countries, we are also favoring this task in the countries. In terms of information resources, there is a whole set, but this is analyzed on a national basis and along with institutional communicators at the regional level. The audiences are different. We need to admit that we have focused much more in cattle and operators in the farm. In Panama, we will develop a training like a pilot for veterinarians of veterinary clinics for minor species, indicating according to the way this emerges and stimulating their work for 2025, 25th. We are also decided to work on resources for educators and other stakeholders as identified in our encounters with communicators at the regional level. That it is diverse. The task force in Guatemala and Honduras means that a lot of this information need to be uh, given in the language of the audience we are working on. And considering the knowledge and reading aspect, we also considered that in some aspects, not too long ago, uh, we translated the resources, but we would like to turn this into audios and to work using WhatsApp support groups. This is one of the elements worked in Mexico. They have developed with great success of first simulation, and next week they are already organizing the implementation of a second drill for next week. And this because of the openness given by Mexico and their collaborative work will allow the participation of other countries, particularly countries that do not have the screwworm, for them to understand the process and to develop similar activities in their countries. We are present in the main cattle events. We need to identify this in advance for 2025 in order to be present with the booth, with informational material in congresses, and a perspective of One Health. And digital means and social media campaigns we started at the beginning of this year in Costa Rica, and we will continue doing so in the different countries, assuring that all this month, even in holidays, we can continue issuing messages related to prevention, control of the cattle screwworm. In the case of Belize, and depending on the characteristics of the country, has made TV announcements and at the road level. As I mentioned, this varies according to the demands and the characteristics of countries. In Costa Rica, we develop a first encounter in presence in One Health. So we see this webinar with great pleasure, and probably we will gonna develop something in presence on 2025. So we're trying to reach more audience because we consider that the population itself has to play an important role in this task. And this is what we have in relation to this transformation. In our slogan, our main slogan, and in our task, and because there is a need of intersectoral or cooperative work, if we want to make these behavioral changes in our audiences, is that together we can work against the screwworm. It is not just that we have this sentences in our caps, but no, this is a slogan with the implications at the private and public level and the different organizations of the public sector. And we are about to conclude with deliveries to the countries, stickers. We're gonna surprise you with the stickers in WhatsApp soon. So, meaning that we need to eliminate the screwworm with two major elements that exceed the disease and that can cooperate in relation to other diseases, revise and cure without stopping. So, with these messages, I'm very happy to see these messages, and I'm very happy with this initiative. We will continue contributing with everything that is needed. Thank you very much. Thank you, Alejandra Diaz, our regional coordinator in this project. All of us against the screwworm. This is our slogan in our sites whenever we share information. Now we're going to give the floor to we're going to leave the questions for the end. You know the logistics when you have seen our webinars with the PPA. So, with the exception in this case, let me introduce. I cannot hear her. So let me introduce Italo Argentina, Leonardo Masticelli. Thank you, Alejandra. So all of us against the screwworm. Perfect. Now let me give the floor to Dr. Leonardo Oscar Masticelli, Italian Argentinian, veterinarian physician with several degrees, graduated in agribusiness, agri-food, quality management, and international trade. Policies and management in the agri-food sector, expert in agri-food policies. He has a master's degree in international relationships, and his thesis was approved with honors. So your summary is quite broad. He is currently a consultant in animal health, food security, and international trade of agri-food at the national level and at the international level as well by promoting the One Health approach. He is a speaker in the topics I have mentioned, and the last official position was in February 2016 to September 2018 in the Agroindustry Ministry of Argentina as advisor in management and in agronomy in this country. He has a series of presentations, publications. But I want to tell you that we are really pleased. We are really pleased, and we thank you for being with us. Please, the questions for Dr. Masitelli, ask them at the end of his presentation, please, because he is with us from Italy, and because of the schedule, in this case, we're going to ask the questions to him immediately after he finishes, because it is too late for him. Without further ado, Dr. Masitelli, go ahead.
Thank you very much, Rocio. I have no problem in staying afterwards to answer the questions. Very kind with your introduction. It is really a pleasure during this stage after my official work and now in the private sector to continue, because you retire from official organizations, but not from your careers. So it's quite passionate and also a concern to see how everything is more and more intertwined. Particularly, the last pandemic was quite serious. And after I accepted this invitation, now I want to focus on food safety and crises like this related to screwworm as part of the focus. because currently we are quite dedicated to this One Health approach because of all the interactions. So I'll go straight to my presentation and I'll start screen sharing. Please let me know if you can see. Yes, we can. Thank you. Please go ahead. Is it fine like this? Well, my proposal is on food safety. Would like to talk about the impact of the sanitary crisis and the impact on food. And in the case of the One Health approach for screwworm, how can this help to prevent this disease? The contents of my presentation, we're going to start with the context when it comes to food safety, food production and consumption, and then the agri-food sector, the sanitary crisis that have an impact on the sector, and of course, including the screwworm, and why the One Health approach. Why do we think it's important? And some proposals towards the end for discussion purposes and questions, if any. So, quickly, the increase in the world population and also the increase in the consumption standards, but not only consumption standards from the type of consumption standpoint or the variety of foods or modern foods and so on, but also the concern of consumers regarding its origin. And if we talk about animal origin food, which is what we are interested in, we have animal welfare. And in this sense, I think that the screwworm, not only from a zoonosis standpoint, but also from an animal standpoint, we need to see that people are more informed. There's a lot of information, but sometimes it's not as good. So this can generate this need on consumers to learn about the origins of the products that they are currently consuming, how animals have been treated, and so on. So the context is of a globalized trade, and it's been the case for quite some time with pros and cons, and the commitment that we all have in the agri-food sector towards food safety. So quickly, as you might have heard oftentimes, this is a chart all the way from 1750 to 2050. Currently, we have $8,000 million and will be 10,000 million by 2050. It's a single Earth and as a global context, but the production areas, and it's important to mention that the population grows, not only human population, but also the animal population, and the contact that is more and more common between urban, semi-urban, and rural areas, along with the fauna, is something to take into account. And it's also important because currently we are in a producing and exporting region of agri-food, and the growth of the population is happening mostly in developing countries, which is interesting as data to take into account. We have two slides to try and demonstrate how consumption grows for animal origin food. And we have a sequence that goes from the 60s and 90s to 2030. But it can vary depending on the context and areas. But this is the source in here is the FAO, but the basis is going to be the vegetable food. But what we see here in dark blue, we see how it grows, because this is about kilocalories per day per person. So the reality is that beyond these areas with problems like poverty, and the fight against this is quite strong. But in general, always when we see more development, when it comes to the possibility of food consumption, we look for foods of animal origin because of their protein and essential amino acids, which are of greater quality. And if we go to meat, we also have here a sequence that go from the 80s to 2030 of different types of food. For example, beef, pork, and poultry, which are with the highest consumption, but also sheep is quite interesting because of the quality and type of proteins. And in here we see that this is currently growing when it comes to consumption as part of this global data. Having said this, the need to feed the population, it's important to have a clear definition of food safety, because sometimes I need to talk briefly about food safety and it is mistaken with food security. But we go beyond all of this. It is a concept that was defined back in the 70s, thinking about the quantity and availability of food. And when we're talking about global, regional, local level, during the 80s, it started to change because we were talking about the access to these foods when it comes to economic and physical aspects, meaning the possibility of getting this food. And we can remember something that happened during the COVID-19 pandemic, because in many cases, physical access was important because of the quarantine and all these problems when it came to movement and transfer and transportation. And not only the economic aspect, but access. So during the 90s, the concept was broader, which is the one that we have now when we talk about food safety and all the cultural preferences, talking about food safety that became a human right. And these are the regions where we have food producers and the commitments that we have towards food safety. So we need to see here the animal welfare and safety, in addition to, in this case, this worm, which is a zoonosis. So this definition of food safety, after the FAO summit, during that food summit during 1996, food safety was defined at individual level, also the household composition, national and global level. It is attained when all people at all times, and it might sound like an utopia, but it's a goal that we all must to understand within our own areas of responsibility, when they could have physical and economic access to sufficient food that is nutritious and safe to satisfy the food needs and preferences throughout their lives. And I want to stop here between what is safe and what is nutritious, because something might be nutritious, meaning that it might have the necessary ingredients and it might be sufficient in order to cover the requirements in each of the stages of life for a person, but that can be nutritious but not safety. It might be harmful because it is there's contamination, or maybe it's safe but not nutritious because it has been sterilized, but it's not nutritious. But this was just for you to have an idea that when we talk about agri-food systems, what are we referring to? And if we move on from food safety to the agri-food system, all this chain of what we call from the field to your plate, including raw materials, industrialization, then trade and access for consumers. These systems given the need to produce food for this growing population, is a very dynamic and constantly growing sector. And we have all these commitments in order for these agri-food systems to work, to be sustainable and sustained. And as we just defined, food safety is important, but also animal and human health. And we can also include the plant health. That can be all part of this, but we are now going to focus only on animals because of this disease. This agri-food system is under constant pressure because of the needs that we need. So each point that we can define and or improve or control and prevent, including diseases and problems that are food safety related, like the screwworm, generates some problems or a decrease in production. So the pressure is not only when it comes to increasing production and controlling food safety aspects, but taking care of the environment. So we're adding something that is environmental related, like residue handling. And what is the impact in this case as part of this agri-food system? We have the growing urbanizations, which is something that happens worldwide. And also when we go from the producing areas where we should be generating the food, and also for the small populations and small farmers. And this is important because that would be like basic, so that we don't have to go to big cities to compete because the costs are higher and the competition is quite important. Also, we have migration, geopolitical conflicts, and we're going to talk about all these problems in a bit. If we can take a look at some of the changes we had in the 70s, we had 63% rural, but these are the changes that we need to have in sight when we talk about all these areas and all these problems. And that's the reason why later on I will mention something that was clearly proposed before, which is related to raising awareness and moving from rural to urban. So definitely humans, as part of all this development context, is what could result in either something positive or negative. Some of the sanitary crises, I like to start with the encephalopathy or the crazy cows, because we had a before and after, because definitely there was also a change in the perception when dealing with this bovine spongiform encephalopathy and other sanitary crises that had some impact at global level and also at regional level. The foot and mouth disease and also the avian flu in the beginning of the 2000s coming from Asia. We had the avian flu, and then it affected humans because of the type of flu, and also swine fever that is causing problems again in some regions in America, and then some bovines have been infected with avian flu. Also, the antimicrobial resistance. This is the week of the fight against antimicrobial resistance, and also COVID-19 was an indirect sanitary crisis because it generated some scarcity in some cases, and also the screwworm. Is it a threat? Well, in some places, it went from this. This is the topic, and it will depend on the area where and the weather and many other things that are clearly indications of this being a crisis or just a momentary threat. The sanitary crisis in general have an impact on many senses regarding sustainability. If I take into account the economic, social, and environmental aspects, which can be demonstrated this way, also on the productive change, a sanitary crisis that interrupts this production chain, and also a crisis that generates the closing of some production establishment and also results in markets closed. And there's also an economic aspect, because if we stop production, we also have environmental related and social related aspects because of the employment losses, and also a slaughter of animals like it happened in Mexico, or foot and mouth disease and slaughter and burial of animals. So of course, there's also the environmental impact, which obviously has an impact on the health and animal welfare. And of course, we have trade and the loss of competitiveness. For example, in the case of a screwworm, there are some requirements that are related to animals that are not in areas where this screwworm is a pandemic, or maybe the animals that have been affected. And if we do not act seriously and in a competitive manner when it comes to managing these types of things in order to prevent this crisis, then we have a loss of credibility too. So definitely we are talking about sustainability. And if we make it as part of the environmental sustainability aspects, and something that is important to be able to have it and maintain it through time. In the case of a livestock screwworm, this would be within the context of food safety, and of course the One Health approach that I'll propose later on. And this is a disease, it is a sanitary problem. If you don't want to call it a disease that has been caused by an agent, but it has been widely spread. And there are some things of concern, like in Mexico and also in the United States and also in South America. So it's clearly a zoonosis of a more or less impact depending on the area where it spreads to, and also depending on the type of work that humans do and their interaction with animals and the degree of knowledge of all these problems. And of course, working on prevention and also control and later on eradication if as the need arises. And I think that this is a very important goal, because what this is about and the impact, which in this case is a more specific impact that results in losses, not only because of the treatment of animals. We're talking about animal health treatment and also the production losses, be it meat or dairy product, and also the problems. If we are talking about food safety, we need to analyze how this can upset or affect animals. There's also an impact on health and animal welfare, not only for production animals, but we also have wild animals, which is also a problem when it comes to having these agents. If we talk about wild animals, there are also transmitting agents and the interactions between humans and this wild fauna. And also as for human health, not even talking about the possibility of deaths, but there is a treatment, medical care, hospitalization, and disabilities, and as I mentioned before, barriers to livestock trade based on the requirements on behalf of importing countries, or if it's within the same area, there might be some barriers for trade, which is clearly a problem. And having said this, evidently we are facing a problem when it comes to management, because we are focusing on food safety, but including this crisis, because this is animal health related, but also how we are going to handle this both officially and privately. This is what can lead to improvement or preventing these types of situations. And that's the reason why it's important, when you have a goal, to generate a good planning and management along the productive change. You first define the product. There's a case of a screwworm, there are flies, there are injuries. So depending on where we are, we need to analyze the chain and start working on each steps of the chain. But as a chain, including all the links, and we need to have a very efficient structure. And it's important, as we mentioned before, to do a risk assessment, of course, in order to generate any type of plan or programming. It's important to conduct a risk assessment and see what the problem is, what are the risks entailed, and also how will I go about it and how will I manage it. But of course, we need to take into account the communication, which is important, because along each link on this chain, what can be done in order to attain the final or ultimate goal, which is to eradicate the livestock screwworm. And that's why in this era of so much technology and fast access to information, that sometimes is not clearly conveyed. We need to see what will be communicated and who will communicate this, and what are the references that we're going to have in the case of this predicament towards the public, before accepting that what we are saying is true, and also what to communicate, what to disclose, depending on the target audience. So we need to analyze the disclosure, the awareness, and also, as I said, this is a zoonosis, and it's also related to how we are going to handle and apply these best livestock practices, for which it is basic to have integrated or team work when it comes to public and private sectors. And we also have the regulators, the controllers, the rules, but in the private sector, we generate the economic business, for example, of cattle raising and the production of foods of animal origin, which is clear. In this case, it's not just a discipline or profession, but it's multidisciplinary and interdisciplinary. So we need to work along the whole chain, including professionals, public and private sectors, producers, farmers, industry, trade, and the public at large. Because at the end of the day, we have consumers and we have the public and the whole chain. And that's why this One Health approach started by being just this One Health, and particularly I prefer this One Health approach instead of talking only about One Health, but we can talk about global One Health, or we must understand that when it comes to food production, there are interfaces that go all the way from food production to health in general, both animal and human, and the environment where we develop this activity clearly. And also, we must understand that for this approach, it is really important to have these activities that need to be proactive and not only reactive. It's not just reacting after the problem, but we need to analyze, train, research, analyze the statistics, and all the tools that we might have at hand. We need to define what can be done for something that is so basic in medicine, which is prevention, because it's better to prevent than have to heal. So we need to be clearly proactive. In here, I have some slides that speak for themselves. They are quite clear. And help the people under this approach. And this is a world that is completely intertwined. and it's going to be more and more globalized. So if we're talking about the different sectors, we have the environment, humans, animals, and as part of society. If we're talking about the local and national sector, we can have different points that can be extended in addition to the society in itself at regional level, in this case, maybe, and also this approach when we talk about, as I just said, if we have healthy humans, we're going to have healthy animals and ecosystems. But of course, we can complicate everything with this diagram or drawing that was prepared in Sweden, where we have more and more things that are being added, different areas, sectors, topic like antimicrobial resistance, vector-borne infections, bacterial infections, viral infections, parasite infections. We also have the type of intervention like vector control, surveillance, also sanitation, food safety, and so on. And in here, we have this in Spanish. It's One Health, where we talk about antimicrobial, food safety, disease vectors, deforestation, climate change, water pollution, and without going into details, but climate change, changes in temperature and in the humidity level. We need to analyze this in order to see some vectors that might disappear after a drought or they might reappear. And you might think, how are they not here? But there are some different ecosystems, and these are the types of things that we need to take into account for a possibility of having this or applying this One Health approach, but in a proactive manner. And quickly, I would like to mention how this situation started. Like with all international organizations, they start debating the possible approaches, like it happened with antimicrobial resistance. This One Health approach is not new, but it started with organizations like WOA and also Human Health, the FAO, the World Health Organization, and recently we have the UNDP program for the environment, and all of them have their a definition. We have here a picture where we see the environment out there in the field. We have the animals, we have humans and horses, and One Health. And since the 2000, we started talking about the different systems, interdependency, and so on. The World Health Organization is also talking about this approach, mentioning zoonosis and the fight against all of these problems, diseases, and other types of zoonosis. And also in the case of FAO, this is it mentions how complex all of these diseases might be. This is a comprehensive approach mentioning changes in temperature and humidity levels and how they might affect on the temporary disappearance of some agents or vectors that are the means for the transmission of these diseases, and also the mobility from people and all the things that move quickly from one thing to another. So this is from the FAO. And we see how definitely, and I included here the professional role and commitment. But it's not just about a profession, like meaning if it's an agronomist or a veterinarian, but I mean professional when it comes to what they do. So if we when we try to improve the situation, when we talk about the knowledge of zoonosis primarily and other diseases, to remind about the basis of all this work that is related to this to try and minimize the subsequent risk. And that's the reason why communication and information is important, and what we can all do, like early alerts, prevention for these types of diseases in general. And if we talk about the worm for zoonosis, and particularly based on all this knowledge and all the training and the scientific base, in order to strengthen and or implement public policies that will be for the mid and long term, like sanitary programs and planning. But they must be executed. They must be well designed, well managed, and executed as part of these public policies that should be sustainable under this One Health approach.
Las propuestas para ir
Proposals to conclude, proposals to include and implement in the national and regional health system this approach. So from this movement of people, animals, and goods may take risks from one place to another one. The comprehensive approach, this is the challenge. We know that we know what we talk about, but the thing is to disseminate this for the public in general, but also to raise it to the corresponding authorities, which are the ones that make decisions to work in that regard in a comprehensive manner from One Health. So we consider One Health is the most efficient and effective manner to work, even in this case of the screwworm. This will facilitate the development of sustainable and productive systems, including the health problems that correspond according to the region, etc. They are, in fact, participatory management models, each one with its multidisciplinary role, and from private sector and public sector. So the need to regulate, to establish the pipeline, the guidelines, and the private one who has the business and the co-responsibility. And the challenge is precisely to reduce, to ground regional, national, public, there's One Health approach, and that this translates into administrative infrastructure consensuated. And with this, I'll thank you for your attention, and I remain available as you wish, Rocio. If we can have the questions and answers now or at the end, I don't have any problem. So let's wait till the end in that case. Now, we're a little bit late. My apologies if I took longer. No, we were late right from the beginning. So we're going to adjust the times. Thank you. Now, interesting, all this, and this is the topic we are promoting, Doctor. So, quite pertinent, your presentation, particularly last slides. Now I'm going to give the floor to Octavio Hernandez. He will introduce our next speaker, Dr. Pedro Garcia Escamilla. He will talk on behalf as a physician, a veterinary physician and producer, and also as a special guest from the Agriculture Secretary and the Mexican Association of Milk Producers. Go ahead. First of all, I want to thank you for the opportunity to continue working and disseminating a little bit the importance of myiasis in the cattle activity in the region, and to cooperate with you in this prevention strategy along with the federal government. We want to thank the opportunity to you as well as to Dr. Diego and Alejandra to be part of this team. We propose the participation of Dr. Pedro Escamilla. Pedro Garcia Escamilla. He is a producer from Chiapas, and he has a broad experience in producing beef and milk. More than 50 years of experience. He has been the general manager of the cattle union of the region in Chiapas, and he supports producers in the case of screwworm. He is doctor in education, and he has a lot of expertise related to the information of the screwworm in northern Chiapas. So I'll give the floor to Dr. Pedro Escamilla. Just give me a couple of seconds and to start. Thank you, doctor. We're ready. Thank you to everyone. It is a real pleasure for me, and I want to thank my friend Octavio and the National Cattle Production for the opportunity to talk about these topics that are related to the screwworm. I am located in Palenque, Chiapas. This is a state that is located at the boundary of the southeast Mexico and Guatemala. So we are really busy with the screwworm matters, not from now, but since a couple of months that we were notified that there was an important outbreak in Central America. So we're trying to prepare as much as possible, not only with producers, but also from the government, from the federal government that has supported us. This is some background. Since 2019, we have a self-declaration as a country free from myiasis of the screwworm, and so far, even some days ago, in this month, we had the opportunity to receive the visit of staff from Senacica and staff from the Department of Agriculture of the United States, USDA, and the AICA. We're here in Catasaja, some 30 kilometers away from the place I'm transmitting in this webinar. They were here on a place of Kazajan where those people came to talk about the screwworm matter, and experts from Senacica to talk about the screwworm and the production of consumption animals and wildlife. Okay, I am in the Chiapas state. It is the border with Central America. It's a very important state in producing beef for national consumption. It is not the first place, but it is one of the first ones in producing beef for national consumption. So animals are sent to the center and north of the country, and this is a very important door to contain the screwworm. What are we doing with the government? We need to celebrate that it is not only the federal government, the one that is worried. He is busy at the state and municipal level. In the images I will show you, these are some colors of the screwworm, some posters of the screwworm. The Secretary of Agriculture and the Environment Secretary and even the Health Secretary have worked together to develop these posters, including the Senacica staff and the National Commission of Protected Natural Areas. We have meetings with producers and cattle associations locally. Speakers of these courses are staff from the General Directorate of Animal Health and Phytosanitary. These meetings with the regional unions is to learn about the fly, to have more knowledge about myiasis and symptoms in animals besides production. celebrate because we have seen an increase in the control of movement of cattle. Even veterinary physicians are taking some scar uh, matters to heal scars for the animal to recover and to be able to travel in the next weeks. So, mobile larvae bathrooms were installed, as in the case of Chiapas, in the case of Wixla and Casaja, that are a couple of minutes away. This larva bath, besides the application of deworming, some veterinarians are applying veterinary to 3.75%, and the inspection of animals that will travel in order to have healthy animals and to avoid dissemination of the screwworm. In Mexico, I insist, we have not had any case of this. Not yet, and we want to continue the same way. Some actions to prevent the screwworm. This is from our producers. We are keeping places clean, particularly free from flies, and that helps us a lot. However, we are using hypermethrin and cypermethrin to disinfect our places. So particularly animals with wounds have been submitted to some procedures, as the case of removing horns and to apply to prevent these animals to be free from diseases. So we want absolutely free animals to travel to the center of the country for marketing purposes. We are also deworming the cattle systematically. We have used ivermectin. As additional measures, some producers use sulfur as a preventive mechanism of the screwworm. I don't know how appropriate this is, but this is the idea of preventing matters that we producers have, as well as people that are following this type of sessions. I also want to comment that I consider good enough that once we have held these meetings with chairs of local cattle associations, in the case of the north of Chiapas State, there are more than 25 cattle unions. They have disseminated the information to their producers, even bringing experts for the information to flow appropriately with courses that do not take more than 2 or 3 hours and with calls on weeks and informing the task conducted internally to have healthy herds. Just to tell you that the flies for the screwworm we have here, the plant was moved to Panama. I found this on an information from the Secretary of Agriculture. So we have this flight that help us to take care of matters related to the screwworm. This is it on my behalf. We continue busy here. I highlight the training we are providing in order to work on a joint manner. Not only those who are dedicated to animal sector matters, but also with the Secretary of Health and the government of Mexico, for all of us together to work to contain the screwworm. Thank you very much. Have a nice rest of the day. Dr. Pedro, thank you for your information. I would like to add, Rocio, if you allow me, last week the Secretary of Agriculture, under the framework of the celebration of semi-annual convention of cattle unions, mentioned the work of the federal government in preventing this myiasis. As Alejandra commented, there was a first drill. We plan to have a second one, and there is a strong strategy. I agree with Pedro at the level of the two major uh, containment barriers that are operating in Chiapas, and another one next to the Tehuantepec Isthmus. The idea is to have these controls that will help us to continue assuring we are a country free from a screwworm, a strategy which is strong enough, but we believe that can be the measure to continue having this health status, and that led us to keep the authorization of our country in animal health worldwide, because Mexico is one of the cleanest countries under the framework of the classification established by WOAH. Rocio, this is it. I don't know if you have doubts or anything else that you would like us to comment. Thank you. I'm going to leave the questions till the end. I do not see any question in the chat box so far. Some comments and appreciations. Dr. Escamilla, on our behalf, we always count on you. We can take this message to this pertinent area in the country with the support of Dr. Marcos Arca, who is always supporting us, although sometimes he cannot be with us because of his busy agenda. He supports us, and he leaves you as his representative to give the floor to the producers. Thank you, Octavio. We have also, I also see we have Dr. Enrique in the meeting, and he is here, and people from the certification body as well, from CNOG. Perfect. I do not. Dr. Armando Garcia is in the meeting. In this case, Dr. Carlos Alcázar will give us a presentation. Carlos, thank you for being here. So if you're here, we can give you the floor. Dr. Carlos Javier Alcázar Ramiro is a zootechnist, veterinary physician, graduated from the Tlaxcala University. He has a master's degree in neurology science by the Institute of the University from Veracruz. He has 12 years of experience in animal health at the national level. In his path, he works on exotic diseases to oversight and application of sanitary strategies to detect, control, and eradicate exotic diseases such as the bird flu, high pathogenicity, prevention of the wood and fowl disease, mouth and fowl disease. He is part of the Commission Mexico United States to prevent the foot and mouth disease and other diseases in animals. The CPA, the beloved CPA doctor, the doctor has also given a lot of courses, presentations to prevent and promote the prevention and notification of these exotic diseases in the different sectors. Carlos Floricio, we want to thank the Armando Garcia Lopez, director of the CPA, for the willingness to participate in these efforts that Alejandra mentioned. We are conducting in Mexico and Central America to prevent, control, and eradicate the screwworm, the cattle screwworm. Go ahead, Carlos. Can you confirm that you can see my presentation? We can see and we can hear you well. Just get closer to the microphone for interpretation purposes. We are interpreting into English as well. Thank you. Thank you, doctor. In first place, I want to thank the AICA for the invitation to this important event. It is for us of great benefit because we can reach other audiences and we want to promote what we are doing at the Mexico and Central American level in order to face this pest. Number two, greetings from Dr. Armando Garcia Lopez, Director of CPA. Because of agenda matters, he had to leave to go on a meeting. But I will present this topic, which is the progress and strategies to prevent the arrival of the cattle screwworm. I would like to start giving some background about the cattle screwworm. We have commented in several events in this webinar. Since 2023, this pest, we started seeing again this pest, and it is some kilometers away from us, some 50 kilometers, according to the last case reported in Guatemala. 57 kilometers from Belize. So for a while, Mexico has been preparing. We have been working in preventive actions, particularly in the southern border of Mexico, by promoting the notification, giving presentations to cattle people. So the fact that the cattle screwworm has been reported in Guatemala starts the alerts in this country, not only for us, but also for cattle people, because they are an essential part in this prevention program. In this other map, we can observe the kilometers trace where we have the last case reported by Guatemala to the inspection points that I will mention later. They are the first defense barrier for the screwworm. So one of the most important places is Carazahat, where an important part of the cattle moves. Well, this distance is translated into a short distance in little time. If an animal with some myiasis moves from this point to where we are. So that could be a catastrophe because the biologic cycle could progress or advance. What is it that we're doing in Mexico? We have intensified the actions conducted in Mexico. One of them is to promote the notification and dissemination of the information about the cattle screwworm. We do this with cycles for veterinary pharmacists, cattlemen. So we leave information, three types: printed material, quite useful, that includes the phone numbers of contact people where they can notify some suspicion related to these animals. Also, we provide presentations to veterinary physicians, cattlemen, and we try to give this type of presentations. We have even given presentations in agricultural schools because they somehow have contact with animals. So this is very important that they could notify any myiasis. This disease, as commented by Dr. Leonardo, is really important to consider it not only in the animal health scope, because it is one of these diseases that falls on the One Health approach, because it applies to animal health, public health, and in the environment. We have worked in favor of this integration into the different institutions that participate to address it as needed. So all together, we would like to address this in a better manner. It is also important to tell you that we have distributed an important samples collectors. As you can see, this is the sample taking kit that we distributed. It has a pipe to collect the samples. instructions for producers or cattlemen can observe, can manage the samples appropriately. And we are also providing this curative powder with an efficient effect to control any wound with myiasis and has this scaring effect. So we do not focus only in the cattle sector. It is not a cattle-specific problem, although the name says cattle screwworm. So we can, some producers believe that it's just a cattle problem. No, it affects any warm blood animals, including human beings. So that's why we give this information in veterinary clinics that have dogs and cats or other minor species that could be prone to an infestation with this pest. So what has been promoted is the control of movement, strict control, particularly in the southern border, and other alternatives such as a dispersion center in Mexico to free the screwworm fly if needed for biologic control. Within the promotion of notification, so is what you can see on this slide to provide assistance to the cattleman in order to give the appropriate advisory to treat the wounds, for example, taken if a suspicion is reported to take care as soon as possible. So our limit is 24 hours to provide attention, and we have a remote diagnosis, and the official lab for this diagnosis is in APA, located in Morelos. And with that, we can make a real-time transmission to get a pre-diagnosis. And the idea is to have the diagnostic as soon as possible, and also to visit producers, cattlemen, and any stakeholder to inform about this health problem. As commented before, we are also preparing. We know that prevention is very important, so the people, staff is prepared is vital. So here in Mexico, we last month we held a drill or simulation with the emergency plan for prevention of the cattle screwworm in Palenque, Chiapas. We had some practices in some farms, but the event was quite successful. We had the participation from different areas, the Secretary of Health, and there was also participation of the Secretary of Defense, cattlemen, the cattle organization. There was an important participation. And the truth is that we believe it was quite successful. We're going to have a second event scheduled for next week, November 25th to 29 in Tapachula, Chiapas, with the participation of our Secretary of Agriculture, and there's going to be foreign personalities that will be participating, including some colleagues from other countries, which is important they can be in this event for them to replicate it in their own countries. We don't have this pest in Mexico to the date, so we very proudly we can say that this pest is not present in Mexico. We're doing everything necessary to prevent it. We know we're not going to be able to avoid it, but we're going to prevent situations, major situations. So within the promotion activities provided, we have provided 364 presentations with more than 10,000 participants that have participated in these events. The epidemiologic week number 45. So we are providing this presentation, we're giving these presentations all over the country for all of us to be informed about the problem the presence of this pest could bring to our country. As a result of this notification promotion, we have had important reports, more than 200 reports we have received in the state of Chiapas. Is one of the major states that have notified this. All of them, all reports have been negative, and we invite producers and people to continue reporting any myiasis that could be identified in their cattle or in the animals, dog, cat, bovines. So this has to be timely reported. States have participated. We have had two participations by state. The species most notified are dogs, 88 reports, all of them negative. The second species with the largest number of reports is the bovine cattle, felines, cats, wild fauna, all species, including human beings. In Chiapas, the Secretary of Health notified this to us, but it was not the case. But as commented, the disease is a problem affecting any warm blood species. So we can observe this anywhere. So luckily enough, this has not occurred in our case. The results, if it is not the cattle screwworm, so we took samples and all of them were negative. The biggest species that we have identified is Lucilla silicata, and the first three are the most detected. As you can see in the graph, we may not inform all the fly species notified or identified. So we can observe that people is fulfilling the goal, which is to promote the report, and once they detect a myiasis, they report it. So with the diagnosis we have in CENAPA, we can inform as soon as possible without the need of spending days or weeks. So what I mentioned before, those are the results obtained of notifications were given by staff from CPA, notifications where they detect myiasis. However, also the offices of agricultural health inspection officers are distributed all over the borders of our country. As you can see in the map, they have collected samples, particularly in bovines and other species that were notified, and they have found myiasis. Luckily enough, it is not the screwworm, the cattle screwworm. Three species of flies were identified from January to October. The main one has been the Piophila casei, Lucilla cuprina, and Fornia regina. As you can see, this is a very important number we have identified. So somehow, it's not only passive surveillance, but they are acting as barriers to prevent the arrival to our country of other type of pests or in some products that could be present. We may wonder, well, if it is from live tissue, well, when the animal was infested of the problem and without the proper management of this myiasis.
As for the control of mobilization, as I said before, we have two barriers that we are considering for defense purposes, which are really important in order to prevent this problem if it reaches Mexico to spread to the center and north. And the idea is that if at a given point we see the presence, we must have the mechanisms in order to defend the cattle exports. And the first barrier would be 3 points for federal inspection and verification. And basically, they control mobilization, and they are in Catazahar, Trinitaria, and Whistler. And the goal is now, Katasaha, is that all cattle that goes through here should be in 100% inspected. And also, we must apply ivermectin, and all the cargo that goes through here is being checked, and a certificate is issued that would be the first barrier. And once it goes through this site, then we're going to have a second barrier that currently, well, for now, it's a project that will be implemented in 2025, but it's the second barrier that will be in Cosamaloapa and Paraíso, the two sites where all these cattle goes through. So any shipment that goes through this second barrier without a certificate means that they did not go through the first checkpoint, or they evaded this, so they'll have to be checked, the animals showered or sprinkled with the treatment, and then a certificate might be issued to say that all these phytosanitary requirements have been met. And first, we were starting this activity. This is the procedure for the review. And currently in Katasaha, we have the canine binomials or pairs. And at night, when normally most of the cattle goes through, it's hard to be able to identify an injury if it's hidden and if we do not have in the right lighting. So the dogs are really important as dog teams or canine binomials, and we have enough teams that are supporting us, and this is the first inspection that is done through these canine binomials, and then we conduct with a visual inspection on behalf of the personnel that we have there. And after this, in the case injuries are detected, then we treat these injuries, and if there is a presence of myiasis, we take samples, and then we apply ivermectin to all animals that go through these points, and then we use ivermectin, and these are they are beneficial in order to eliminate this myiasis. And the ivermectin and these spray bats have been used by technical experts in Mexico that have been testing these products. And once it is applied, then they can proceed to issue a certificate. And this is something that has been done by personnel of Seneca, and currently with the support of OIRSA, we're going to have all of this in order to be able to issue these certificates. And the goal, the first investment was for all these spray bats that are currently being applied, and this is free. But after next week, it will come at a cost for the recovery in order to be able to implement these activities for as long as needed. In here, we can see the actions being taken by our colleagues. These are the canine binomials. And once the animals are down, then there's specifically an inspection, and then they are mobilized throughout this corridor looking for some type of myiasis. These dogs have been trained with the scent of the screwworm and both like some sort of wound. And after this, the injuries or wounds are treated once they have been identified, and then the treatment is applied after this inspection. And then subsequently, these animals, as I said, are taken to the spray bath. This is like a tunnel, and in addition to all the things that we needed to apply in all the body of the animal, and we have recycling in order to prevent the waste and the contamination of the soil. That was in the morning, and there's another video for the night activities where we see how the animals go through the tunnel, and these tunnels are 6 meters long, so that they can guarantee that the animals will be completely covered by this spray. As I said, most shipments travel at night, and somehow the technicians have been trained in order to conduct these types of activities. So even if it might look simple, this is quite complex. So they need to take care of the animals because of their well-being and welfare, and also to attain the goals. And in addition, we also have this spray with other types of products with larvicides, and also we must meet with all these requirements so that it can be sprayed with the product and then eliminate any problems. As we can see here, we have our colleague. So through the use of a spray pump, is applying these larvicides, and then they are doing all these same actions. And also, when the activities are more complex, is when we have more animals. So in addition to the spray bath, which is a single line, which we currently have working, they are supporting with other backup pumps at these inspection points. In Casajata, we have 3 lines, so we are trying to progress as fast as possible. So it might be complex because this is transportation on animals, and it's not as easy. So it's not like a robot, because animals can refuse to cross, or it might take them longer. So that's why on some occasion we experience this type of delays. And also the situation in the Salinas River, which is near the border with Guatemala, we also have personnel as part of this commission that are currently conducting cattle inspections, and also the application of these larvicides with these motor pumps, with the purpose of minimizing the risk of entry this way, which can be a possible source. In here, we can also see the advance when it comes to these baths in Wixla at a different point of part of these federal checkpoints. There's not much traffic, but it's also an important point, and the progress has been very good. And as of next week, we'll be starting with some activities with different modules or cabins that will be installed. And this is the progress made so far. And these are other alternatives, as I mentioned in the beginning. Basically, we are planning for the future, and if necessary, to have a different center in Tapachula for sterile flies, in order to try help this control if this plague enters the country. And if necessary, we are analyzing other alternatives in order to make progress with all of these to the north of our country. And all these strategies have been foreseen. However, they will be implemented only if necessary. And I must add that we are not talking about absolute control when it comes to sterile flies. In order to be able to control the flies for this cattle screwworm, we need at least 80% advance in terrestrial control. We need this progress by visiting the different ranches and applying all the measures that I explained before, in order for this to be effective for control purpose, and otherwise it will be worthless. And but we have made much progress with all of the activities that we currently have. We also have important campaigns for awareness and the support of the Inter-American Institute. And we are working on some drills, and also with the cooperation of IICA when it comes to the financial and logistics aspects. and we've gotten lots of support. And somehow we work with international organizations to try and see how we can face this threat of screwworm. Well, this was my last slide, so I don't want to take much of your time because our time is limited, and thank you for your attention. We're going to leave questions for the end, and now we'll give the floor to Dr. Veronica Gutierrez Cedillo. We are behind on the schedule, so we are trying to cut short some presentations. I'll ask for your support. And the questions, I'll ask our public to write down your questions and who they are addressed to in order to simplify the process. Dr. Veronica Gutierrez Cedillo is a veterinarian and from the National Autonomous University of Mexico with a specialty on small species, and she has been trained in Colorado, the US, and also in public health. She has also a master's on organization for the administrations of health services on behalf of the University of La Salle in Mexico, and has also been advisor to different theses for MBAs at the Public Institute of National Health. She was also coordinator of the technical session on zoonosis on the Mexican Institute. And she was also a consultant in different meetings with the World Health Organization on human rabies transmitted by dogs. And currently works in zoonosis, in public health, and the National Program for Prevention of Diseases. And she's also the link for the One Health approach. Please go ahead, Dr. Gutierrez. The floor is yours. Dr. Gutierrez?
Bueno, me parece que no está de momento pudiendo ingresar.
I think that she's having some problems.
Vamos a ver. Creo que tiene algún problema técnico.
She must be experiencing some technical difficulties, I guess.
Bueno, no sé si esté listo de momento entonces la gente de Semarnat.
So can we continue with the Semarnat?
El doctor Alonso Rivero y el
Dr. Rivero, Murillo, and Cuevas. I am Edgar Cuevas.
Bueno, me parece que la doctora Gutiérrez tuvo
I think that Dr. Gutierrez has some technical difficulties, so she won't be able to make her presentation. So we'll continue with the Semarnat. Dr. Gutierrez and the whole team of Senaprese have always been in contact with the Senacica, and particularly now with CPA, not only rabies, but also avian flu, screwworm now. And they've had a very active participation at the Health Secretariat on disease prevention and control during this first drill, and hopefully we'll have an active participation for the next drill that will be conducted in Tapachula next week. So we have Dr. Murillo and Dr. Cueva. And so Dr. Cuevas is a veterinarian and coordinator of wildlife. She is in charge of all these projects at the Secretariat. And also our point of contact for One Health on Eco Health. So, Dr. Cuevas, please go ahead. Can you turn on your screen and I'll stop sharing my video. Can you see my presentation? Please go ahead. I have problems with my camera.
Muchísimas gracias. Agradezco la oportunidad.
Thank you. I am grateful for the invitation. Thank you, organizers and Dr. Campuzano. For us, as Semarnat, it's really important to address these topics because we want to participate and cooperate with something that is so important for our health. Next, please. Where okay, there we are. Well, this is a plague, and it's important to know about it because we think that there are 1 or 2 generations of professionals who haven't had this approach. We don't have much knowledge about these plagues, so it's really important to have these types of trainings and to take this to all our personnel because we can try and cooperate with Senacica because of this plague so that we can reduce its impact throughout the country. And that's the reason why we have dedicated ourselves in a multidisciplinary way to determine the impact of this worm. And we have identified the potential impact of this screwworm that goes from the mortality of some species that are threatened and are critical. And this can lead to the lack of balance on the ecosystems and to the spread of more diseases, a reduction in the habitat quality, of course, throughout all our ecosystems, and a reduction in the animal and wild animal populations, and particularly mammals, which we have identified in Chiapas, Tabasco, and the southern region of our country. And this might result in a reduction in the population of fish and also economic impact that it might have on ecotourism, and also some sanitary alerts that might result in the presence of this a worm in tourism areas and natural protected areas, and also changes in the dynamics of competitions between the species, which might have some adverse effects in all the programs that are conservation related that we have, like jaguars, wolves, depending on the area where they are, or this disease might spread to, and the impact it might have on wildlife. And as my colleague mentioned, we think that this is a source where we have the first and second barriers, meaning that we have coordinated information with Health and Senacica and helping in all their tasks. During this first stage, we need to strengthen reports and notification of these myiasis cases on wildlife for those animals that are affected by this situation. And in this context, we need to maintain some measures in the region in order to stop the progress of the screwworm. And we have identified that it can affect animals that are more vulnerable. So we have identified in Chiapas and Campeche, which would be the wild animals that would be affected. And we have a distribution of species where we have 9 animals, all the way from carnivores, primates, and the key areas for all these mammals all the way from Chiapas to Campeche, to see what would be the species of indicators, and also to see if hypothetically the screwworm enters our Mexican territory and how the spread might look like. And also we have the key areas or points that we have that might be affected in El Triunfo, in the Chiapas, in Tabasco, and also in the mountains where we have primates, deer, also those areas with a more dense biodiversity. And we have categorized all of these wild animals that might be used as indicators of the presence of these types of diseases, and also in the Mexican territory. And in coordination with Senacica and the health department on each of these areas, we have pumas, we have the white-tailed deer, and all these other species. And each of these species have the impact that we have identified jointly at Semarnat. And we've also wanted to exchange all of these during the next drill so that we can test the strategies that we have identified so far to see how we could act in the event of a screwworm entering the Mexican territory, and how all of these elements would be affected, everything that we have identified, and the strategies that we want to implement alongside Senacica and health. For example, the high mortality on these threatened species, the strategy is surveillance in these protected areas by applying constant monitoring, and also to implement and also in coordination in order to detect the presence of the flies or screwworm or myiasis. And the idea is to detect any point of infection and parasites. I'll move quicker, even quicker, to see if we can make it more dynamic. And we have in here the impact on our wildlife and the lack of balance that this might result in biological corridors that we have identified in these protected natural areas to facilitate the movement of prey, and also to detect the myiasis that we have detected out there in the field or have been reported in order to have the timely notification to Senacica. And also the spread of secondary diseases, and also the report and treatment of backyard animals in those communities within the natural protected areas alongside all of them. And as part of our strategy, we've seen a reduction in our habitat quality as a result of these screwworms, but the idea is to implement projects for soil conservation and reforestation in these areas that have been degraded next to natural habitats, and also to protect and restore the plants. And we have also identified that the costs will be out of hand when it comes to control and handling. So it's important to coordinate all these activities with Senacica for control purposes, and to the extent possible to prevent the entry of the screwworm into national territory. And that's part of our strategy in order to face all these costs by cooperating with national and international organizations, and also to share the costs for the handling of all these activities and reduce its impact. And we also have periodical census, and also the economic impact on ecotourism and also responsible tourism and volunteers for these protected areas, and also to promote reporting in all of these areas and safeguard the presence of tourists, and also to maintain all of this in to try and raise awareness and report all these activities. And as I mentioned before, I think that there might be changes in the dynamics in the case of some species that might be reduced after being affected by the screwworm. So we must monitor the interaction with the different species and to come up with strategies for conservation. And in this case, to minimize those changes. And also, we have some conservation programs, and to include some emergency plans against the screwworm for these species that have been threatened, particularly in the southeast of the country, in order to guarantee the recovery of the species and to continue without being them much affected by this plague. And as I said, we have 10 potential impacts that we might find. So the most important thing to take into account is that we are supporting each other when it comes to conservation, restoration, and monitoring in the hypothetical case. And from the One Health approach, we must protect the ecosystems and the reduction of interactions between the wildlife and livestock, the implementation of programs for surveillance and control based on the health technology. And the idea is to control, to promote the sustainable handling of resources and reducing the impact of future zoonotic threats. And we also have this coordination in order to get a faster response. In order to face this disease, because we must coordinate for prevention and control, and in order to get this One Health approach. And in here, we must take into account that the screwworm and the key factors would be warm, humid climate, the presence of livestock, wild fauna, and cross-border trade. And yes. And to conclude, we must take into account with different impacts and also the importance of a coordinated response. And with the possible impact, and if we don't take preventive and control actions. And there's also a commitment for monitoring and reporting the cases when there's and we work with Senatica to cooperate on prevention, education, and the implementation of contention measures in other areas. And we also coordinate with the Secretariat of Agriculture. And there are also some agreements in order to be able to control and eradicate. Yeah.
Bueno, gracias. No, te iba a decir que si podías ir un poco más despacio para que nuestras traductoras, nuestras intérpretes pudieran escucharte.
We apologize, but they were reading so fast for the interpretation purposes.
Gracias, Edgar. Bueno, la verdad que interesante y me gusta que lo estén viendo como un compromiso. Felicidades.
Interesting, and I like that you see this as a commitment. Congratulations and thank you to Dr. Fernando Wall, General Director of Wildlife, for the support for you to be able to participate in the webinar. And I like you are seeing this as a commitment, as always. on a cooperative task. IICA and could help in any action. The Secretary of Health and Environment will take. We are here to support you with this regional project, and particularly at the local level. We are here to support you and to take the message. Please take the message to the superior authorities, because we are here to promote the actions. So have a responsible person on communication. Although she's new, she has been getting updated in the topic and in communication training where the project is being oriented. So feel free to support the support required. Now let's listen the NGOs. Since it's One Health, we also invited the parties that are related to the NGOs. And to do so, we have Dr. Luis Fernando Guerra. Could you turn on your camera? Thank you. Hello. From the Wild Conservation Society for the support. Since I was in the previous position with WHH, we have again good communication with life. You have always provided your support. Dr. Luis Fernando Guerra is a veterinary physician graduated from the University of San Carlos, Guatemala. He has a master's degree in conservation and management of wildlife from the National University of Costa Rica. Since 2018, he is the regional coordinator of health for Mesoamerica and the Western Caribbean in the Wildlife Conservation Society. With headquarters in Guatemala, he has led several conservation projects as well as monitoring of species and the implementation of the One Health approach, focusing preventing diseases, promotion of coexistence among human beings and wildlife, as well as the promotion of community health initiatives in Guatemala. Go ahead, Luis Fernando. Floor is yours. Thank you, Rocio, for the invitation, and thanks for giving us this space. Can you see my screen? Yes, we can. Get closer to the microphone for interpretation purposes. Thank you. Thank you for the opportunity and the space. And talking about the potential impact in wildlife is a little bit complex because we cannot measure it as such. We do not have this management of wild fauna that is free as we have in the case of cattle. So we're going to try to talk a little bit more about the impact of activities and how this can affect wild animals in protected areas. For those of you who do not know, WCS is an NGO that has more than 125 years of existence and works in different regions and different countries worldwide. And we have different regional programs. In our case, we are working in Mesoamerica region, where we have different country programs, and we are especially working with different activities and with the typical One Health. This is another diagram of many diagrams we have in One Health. What matters here is what we're talking about, cooperation and communication that should exist at any level, social, economic, political level. It has to be at different scales, local scale, national and regional scales, and to work in conjunction. So we always need this communication between the different disciplines and between different institutions in order to reach the goal of One Health, which is health for all, health for humans, ecosystems, and animals. And In the case of public health, it is important to consider indigenous and local communities. The research of disease ecology, and also to consider the protected areas and environmental management, as well as wildlife trafficking. In this case, the screwworm, not only wildlife, but also illegal traffic of cattle. That may be the triggering factor in wildlife. And to see also the health of wildlife that could be considered also as the origin of diseases, because this approachment with the wildlife and the relation with the environment and domestic animals. In WBCS, we work in 5 lines: wildlife health, with emerging zoonosis, mitigate livestock disease, build veterinary capacities in the countries we work, and global change, to catalyze global change. In order to implement, we need to make changes at the political level in order to have this One Health approach implemented. As mentioned, we work in Mesoamerica. We work in the 5 big forests of the region. This is an opportunity that we see to work in conjunction, because these 5 major forests are cross borders. All of them are shared from Panama, Colombia, Costa Rica, and Panama, Costa Rica, Nicaragua, Honduras, and the biggest one where we are located, and it is of great importance for Mexico and ourselves, is the Mayan forest. I believe the biggest or the largest forest in the region. It has Mayan mountains, because it includes Mexico, Belize, and Guatemala. It is within the route livestock users to cross to Mexico. So this is a barrier that may exist to prevent the arrival of the screwworm to Mexico. Considering these protected areas help us, and we need to take care of. And this is the opportunity we have now with for us to be able to react on time to prevent this from moving to Mexico. Why the forests are important? Punctual data with an important impact. There are 3 times the size of Switzerland. I have 7.5% of the planet's biodiversity, and the Mayan forest is the biggest one, the largest one, 3.13 million of acres, shared between 3 countries. So this is important to consider because of the movement of animals that exist there, and a case that may happen in one of the 3 countries may affect the other 2. This place has a lot of biodiversity, cultural wealth, important to inform the ecosystem services we have with forest, and it also protect us. They protect, to have a healthy ecosystem protects our health. So we're going to have healthy humans and animals. So one of the main triggering factors of the zoonosis is appearance, growing demand of animal protein, intensification of sustainable agricultural intensification, sustainable climate change, and all these are the threats of protected areas. Everything is connected. For us to have good health, we need to protect the natural areas, and it means that by protecting natural areas, we protect our health. Same threats are the ones that may occur in the loss of biodiversity and the appearance of zoonosis. Also, to take into account that within these protected areas, there are many communities with domestic animals as livelihoods, and these livelihoods may be affected by the arrival of the screwworm in these natural protected areas. And it is necessary to have this control, surveillance for this to happen. We're not saying that it is happening, but it may happen. In some Central American countries where cases are reported of this screwworm, this is established. We have reports of deaths in Costa Rica, Honduras, and Nicaragua because the blind spots where the illegal livestock that moves that may have a screwworm may affect wild animals in these areas. So the way natural protected areas may be impacted as well as wildlife is through these routes of traffic that are illegal. They are not crossing using the points that are official points. This may be the impact that may cause to wildlife and that may affect natural areas. These are maps of a report where we can see the route of the livestock. It also coincides with the outbreaks in the different countries. So we need to consider these routes because that may be an entry for Mexico. We have registered, and this is Mama, this is it's not the screwworm, but these are trap cameras. Wild animals with worms, it is not easy to detect or to track these animals after locating them, to treat the wounds and to prevent other outbreaks in other species. This is a case in Colombia. Please consider that in South America, this is normal for them to treat these worms and domestic and wild animals. This is how cases in wildlife look like. This is a tapir. So because of their size, they have a lot of wounds and they damage themselves with branches or fights. So they may have wounds and they are key for the screwworm. Excuse me, could you go slowly and get closer to the microphone because you sound choppy. As I was saying, those are cases of tapirs in 2018 and 2019. It was detected the presence of the screwworm. This one is a treated wound where they were able to clean the wound and to add healing material. So you can see the initial wound to the left and how tapirs are moving with this animal inside. And they can move through other species. The tapir is the most visible one because of the color, but we know it may affect many other species. So this is what may happen. We do not have control to treat these wounds. We need to provide anesthesia to the animals, and this is not the advisable thing to do because we put the animal into stress that will be evident, and the animal may not live depending on the condition it has. So those are impacts the wildlife may have, and probably we're not going to be able to control nor to measure or how many individuals may be affected. And what matters is to train people, particularly rangers. Many countries use this tool called SMART. In Mexico, you have a pilot in Montes Azules where CONAM, Senaprese, and Senacica are working all together. And this is the idea to train the rangers and to mention to them the threat of the screwworm, where they have detected dead or sick animals that may have myiasis or worms, and for them to report it as soon as possible. These pilots help to have this communication under the approach of One Health with this cooperation. It is important that we can use this type of tools that are known by rangers and communication of risk to any sector, because very often it remains with veterinarians and not with rangers or other people that may have access to people, animals that may be sick because of the screwworm. I end as a recommendation of the approach One Health is the communication and development of capacities is vital in this point. With the screwworm, it is a good exercise for ministries to be able to work and to pay attention to monitoring and surveillance and threats to wildlife. The threat is the illegal movement of livestock, control of infestation, education, and community participation. It's important to inform communities that may have this screwworm where they live and to train them, because very often at the field level people have wounds and that may be affected by the screwworm, and investigation, research, and intersectoral collaboration. Thank you very much. Thank you, Luis Fernando. We have several questions for you. So now let's move to the next presentation. We have our beloved Dr. Jose Joaquin Oriamuno Toledo. Dr. Oriamuno, are you still there? Are you still here with us? Perfect. Could you turn on your camera while we read your resume? Dr. Oriamuno is Costa Rican veterinarian, zootechnic veterinarian, graduated by the Faculty of Veterinary Medicine of the National University, Autonomous National University from Mexico. He has experience in business management with emphasis in negotiation and marketing, as well as administrative interaction. He is an expert in strengthening veterinary services and certified as an expert of the World Organization of Animal Health. He currently is the General Director of the Center for Strengthening of Veterinary Services, better known as CEFOS Vet. He is developing, among other topics, the One Health approach, human well-being, public health, public veterinary health, and he has experience in Costa Rica. He has worked in several international organizations, conducting several consultancies in different cooperation organizations. His performance is pertinent to highlight he was the first representative, sub-regional representative of WOAH for Central America and the Caribbean, with headquarters in Panama. In the official sector, he worked as a veterinary physician in the Office of the Ministry of Agriculture and Livestock as General Director of Animal Health. So he has a lot of experience as Dr. Macitelli, Dr. Carlos, So among his activities, his role as president of the Veterinary Physicians Institution for 2 periods is highlighted. Dr. Oriamuno, welcome. I do not see your camera yet. Well, I have to say good evening, not good morning. I don't know what happened to my camera because it says that the host has not enabled my camera. So maybe you could help me with this. Our information ICTs could help us opening the camera of Dr. Jose Joaquin Oriamono, but if not, there's no problem. I just ask you to get closer to your microphone for interpretation purposes. Good. That's good. Thank you. Go ahead. First of all, I want to thank the invitation. Greetings to Rocio, Alejandra. I heard my beloved Leonardo and the panelists. It is an honor for me to share with you. Because of time reasons, I'm going to try to be really concrete in touching the major points. And I have to talk a little bit about the sanitation, education, key for the success in preventing, controlling, and eradicating outbreaks. We're talking about the screwworm, so we can generalize because it has been mentioned in previous presentations. The importance of this or other type of diseases. I will divide this presentation, if you agree, the concept of One Health, of course, and the impact of the screwworm within the concept. We will divide this into generalities. There are not too many because I am the last one, so all of them were already mentioned in detail in previous presentations. We're going to talk a little bit about the veterinary education. So education related to veterinary services. To train veterinary physicians and professionals. Also, I want to talk a little bit about the screwworm, but I'm going to guide this because I do not want to reiterate what has been said before. So the idea is to relate the topic to canines or stray dogs control. The way to control this program, and to do so, we have also stray dogs. They are a problem, of course. Generalities, not too much to say, but the importance of these four stakeholders, human beings, animals, and plants, and the health aspect of the three major factors, all of them sharing and being in relation with the environment. Definitely, the concept One Health is not a new concept. Leonardo commented something about this, and it is very interesting because it up at the beginning of the decade of this century, we start working hard with all these concepts. So this is something that corresponds to us. I mean, diseases, there's In fact, in this One Health field and celebrating the week of antimicrobial resistance or reluctancy, we're going to focus this in order to achieve goals and the topic that have us here. Something important, our center, which is strengthening center of veterinary services, emphasizes a lot in this regard. Veterinary services as a whole, nationals and official ones particularly, play a vital role, a particular role, which is very important in preventing and controlling diseases that will represent risk to health. On the other hand, something that has been managed and that implies for a while now, and it has been intensified. The the AH has been mentioning this, and it says that 60% of pathogen agents that cause human diseases have their origin in domestic or wild animals. 75% of human diseases, emerging infectious diseases, have an animal origin, and we can continue with data of this kind. The impact is huge, and the importance to manage this is considerable. So let me talk a little bit about the veterinarian education that has many years of the veterinary physicians group that I belong to with great honor and proud. It has been suffering or experiencing changes from the beginning, because it will continue making or having changes. So simultaneously in the education of the veterinary profession, this has intensified an important part of veterinary services,
including the formation for these veterinarian technicians and those who assist the veterinarian doctors. So I think that this part is really important. A lot has been said about these programs for education, but as for this particular topic, it is really important to have this for veterinarian professionals. We'll take a look at the definition by WHOA, WHOA, for the technical veterinary assistant. It is a person that is authorized by the veterinarian association, wherever they are, and things are defined in order for the person to develop some tasks and functions that will always be supervised and under the responsibility of a veterinarian, which is really important. Why? Because unfortunately, for quite some time, and this is still the case in many of our countries, some technicians or professionals are being trained without control. And obviously, this is important because we must standardize this training. And it's not like I'm deviating from today's topic, which is a screwworm, but we'll need to analyze how important this is when it comes to programs for the control of diseases, and particularly the screwworm. In the case of these professionals, I have been working and insisting upon the standardization. And in Costa Rica, we have defined 4 standards for veterinarian technicians, and they are being applied under the basis of the international guidelines, particularly from the WHOA, not only when it comes to training, but also for competencies. And obviously, in addition to a series of categories, this concept will be totally focused on animal health, public veterinary health, and lab diagnosis. So the core for this would be this One Health approach. So I think that the idea definitely is to add to all of this and somehow among all the stakeholders that have already been mentioned to increase the importance of all these multi-sectorial approaches, both on the private and public sectors. We must set the steps. And we must add to this all these actions under One Health. So something interesting is that most veterinarian assistants that are graduating from different institutions, most of them do not apply standardization as of yet. We are amidst this process, and they are focusing on some clinical aspects. So it's important to expand this vision and function under this One Health approach. And in this case, of course, I am not going to go deeper into the psychological cycle, but what I want, and obviously I am basing all of these on topics that have already been mentioned. So the idea is to insist in the presence of this problem currently in Central America. And I wanted to mention that I was not part of I have been lucky enough when I was director of an institution in Costa Rica, and since then it's been times of peace. But of course, we always have some problems when we detect these diseases, and then we must start running in order to structure all the different programs. And definitely, as I said, I don't want to go deeper into the disease, but anyhow, as already someone mentioned, this is really important, and the most important thing is to set some controls and barriers. Of course, I want to insist on the presence of this disease and the importance that it has. During some prior webinars that have been coordinated by ICA, Senapica, and OIRSA, so they have insisted that the statistics are going to indicate how important the presentation of all these cases are. So not to go deeper and take much of your time, I like to mention to you some aspects that are related to what I mentioned regarding the paraprofessionals. And by this, I mean street dogs. And as I mentioned, the importance and difficulty for these wild animals and how important these dogs are. we know that a street dog either has or have an owner at a given point. So we see these types of problems that are the result of either ignorance of people because it's their responsibility, and also the mishandling. And it's already been mentioned how we can combine this One Health approach. And I would like to mention, you can call me narrow-minded, but I think that this goes hand in hand with One Health, and it is related to welfare. And in the case of street dogs, of course, we are talking now about the screwworm and some wounds in dogs that will hardly be treated. So it's going to be really important to, and as mentioned during some of the presentations, it's important for the prevention of other zoonosis diseases, which is the queen of diseases, which is rabies. So I think that all of this goes hand in hand, and it's something that we need to integrate definitely as part of a general program. But I think that it's not like we're reinventing the wheel, but definitely for quite some time, I'd say 20 years, WOA, which back then was OIE, dictated some international rules. And as part of all of these codes, we are going to find a chapter which is a 7.7, discusses the handling of dog populations, and maybe you can go to this link where we have an ABC of all the recommendations regarding what is needed to implement as part of all of this. Unfortunately, people do not see beyond in general. So as we said, it might be lack of knowledge, out of ignorance, but the truth is that many people act this way. So it's up to us, up to all of us who are out there in the One Health field to be able to communicate and inform all these populations in order to start controlling this topic, because this is so important for the transmission of diseases. We are talking about One Health, and that is all part of the solution. And it's related to the wellness. And also, of course, we needed to unify our efforts, be it through a rescue, adoption, and many other programs that we must work on, and including neutering, and also we must be responsible for our dogs. And we have discussed this with the different groups of people, breeders and owners, but for veterinarian animals. So I have no doubt that discussing this topic with all the stakeholders is going to bring positive results. We need to work with the municipalities, we need to work with local governments, and we have been working on presentations in this sense. So honestly, I do think that the control of street dogs is something that should be done by focusing on this one wellness, one health, and of course cooperating in this sense with control programs and future eradication of the screwworm, which is our responsibility, because we need to take the lead as part of this forum, which is undoubtedly important. So I want to take this opportunity, and I am about to come to the end, so Rocio does not get mad, but it's important to be responsible. And in this sense, we have a project that we have not started, but we have everything when it comes to responsible ownership, so that we can go to primary schools, elementary, and start working by communicating children, so that we can have an impact on adults regarding this responsible ownership of animals, because we must teach them about the behavior of animals, in this case, dogs. And obviously, we must improve the well-being of these populations, and maybe reduce the number of dogs. This is quite complicated and has been solved. Well, I'm quite old. I'm one of the oldest in this meeting, but I remember since I was a dog that these topics were being discussed in relation to wandering dogs. But it is the case today, but they still have some efforts. But I think that all of this is really important in order to be able to handle this topic. Control. How are we going to prevent or contribute with our grain of sand to prevent and control the screwworm by handling dogs? Without organization, we have nothing, but we need to join efforts. We must work hand in hand. The rescue must be aimed towards a goal, and the same for adoption. So they need to be responsible. And that's a titanic task that has been undertaken by some groups. And I bear witness to this. I have so many people that are providing their efforts. And of course, reproductive control is necessary, but in order to get this, the legislator, and it's important because in most of our countries, in spite of the fact that we might have legislation in relation to animal health, but and well-being, but we need to focus the legislation so that we can facilitate the implementation of this program, because I think that education is something that we have tried to address, even though not in depth, and we must work with veterinarians and also in general the population and owners, to those that somehow have a direct relationship with animals, particularly dogs. And of course, communication, which is part of the program that Alejandra proposed at the beginning of this session. We have discussed all these ongoing efforts on behalf of ICA and all its alliances to attain these goals. So to conclude, I do not want to go deeper into all of this, but I would just like to make this a part of all these control and prevention programs on screwworm, as part of all these efforts for this segment, not only when it comes to education on the topic and going deeper into it, and also in relation to all the veterinarians and in general, but also the control of street dogs from any standpoint as a problem that is related to this One Health approach. I don't want to go deeper into all these topics that we have discussed, even though I really love them. But I could talk for hours, but I rather leave this space for you to ask your questions and make your comments. And once again, I am really grateful to Ika, Rocio, Alejandra, and all the organization. And obviously, ICA Mexico, my dear Senacica, and obviously all the people that we have been working with, all the panel members that I had the honor of sharing with. And again, thank you very much. Thank you, Dr. Oriamono. The truth is that it's really important to consider other professions and not only veterinarians. And this One Health approach integrates everything. That's the reason why we created this webinar. It was really necessary to have your participation. So unfortunately, we did not have Dr. Gutierrez Cedillo with us. However, she is willing to keep on participating in all these initiatives. We've had a years-long relationship with Dr. Gutierrez Cedillo, so I would like to emphasize because we have a representation of all sectors, and now we'll have a very brief Q&A session. I have asked Dr. Hernandez to support me with all these topics, and I will ask you to please have very concrete, specific questions because some of them cover too many aspects. It does not mean that they are not important. However, they cover too many topics and are not specifically about the presentation. So, my dear Octavio, I'll start with the first for Dr. Leonardo. Doctor, a question. How can we negotiate to integrate the One Health approach when we are negotiating the phytosanitary requirements for imports of animals and some animal products? How can we integrate these under this focus aimed at prevention of livestock or cattle screwworm in your experience? Thank you for the question. The negotiation, when we establish a requirement that ends up in a phytosanitary certificate, the importer sets the rules and the exporter decides, first of all, if they want to accept them or if they can. And in this case, with WOA, they set the rules for some diseases that might have an impact and also result in trade barrier. So if we go back and under this focus, if a country wants to export, let's say, animals, the importing country demands, if we're talking about free zones, and also about the handling, in this case, of a screwworm. So there are some countries that needed to integrate previously, and they need to take into account what is recommended by international organizations, in this case, WOA. And once we have this, then it's just about how can I comply with all this, and also what the challenge would be, how to go from this focus, which is comprehensive and not only related, well, to trade in this case, but it's not only related to health, and well-being of animals, but it's not related to human health, but related to trade barriers, as I mentioned, because a screwworm is a barrier. If we do not control this, it's going to be a barrier for traders. So it's all about the decision of the exporting country to define which problems will be accepted as requirements and what, if I want to export, then okay, for the organizations, we must have training on all these requirements and everything must be taken into account. So this is the case for many different aspects. And since 1995, we have the World Trade Organization that has been of help because they have taken WOA, for example, as the technical reference. So there is this basis for all the requirements that have been somehow agreed upon, but all 180 something countries that are part of WOA, so that facilitates everything. So before 95, it was more complex because there was no World Trade Organization to state, for example, for international trade, I have an agreement for phytosanitary measures based on the recommendations of international organizations. So this can be used as the basis for information, and then each country can decide to adopt it or not. And including all the preventions, treatments, controls, and sampling. Well, I try to complete the idea. Okay. Maybe we can summarize the questions for a CPA because we only have a couple minutes, but we cannot take many more minutes after the hour. We received many questions specifically for Dr. Alcázar, and they are asking how the verification works, on how operations work during the inspection points, and also how does it work at the origin and the actions taken with the animals that are suspicious. And okay. Please go ahead, Carlos. What's been done with the inspection? I don't know if you mean the animals that are exported or national. No, we are talking about animals that are being mobilized from Central America and also nationals from the southeast. Well, for animals that are imported, that's one of the doubts that we have received from many growers. Why haven't we closed the Guatemalan border? Because of the problem. So the screwworm is not a communicable disease, so it does not imply imposing quarantines like foot and mouth disease and others, because of the solution of the treatment. But we're talking about myiasis, and once the animal recovers, there are no problems when it comes to mobilizing them. So because of these situations, we have not closed the border as of now. And we have open imports from Guatemala to the extent that all requirements established by Mexico are met for all imports of products and live animals. We have requirements for phytosanitary requirements, and as part of these requirements, we can include the applications of ivermectin, the sprays and inspections. And when they are imported, they go through the border, and they also receive an inspection, and that's what we certify. And for national animals, those that are mobilized, for example, from Chiapas to the center or north of the country, at the origin, what we are trying to do is to conduct a review on behalf of the growers and also the certificate organizations, particularly the veterinarians and third-party specialists that issue these certificates, have the responsibility of conducting an inspection of all these animals prior to being disembarked. So the Senacica personnel is not in charge of this because in this case, we have the veterinarians responsible or third party that are authorized or they are in charge of this activity. So in order for a certificate to be issued, they must say that there's no problem with the animal and we are complying with all the legal requirements because the animals need to be supervised and not have any fresh wounds before embarking them. So that is something that it's been done at the origin. And obviously, when they go to these inspection points, they conduct another inspection. And also there's this myiasis. And of course, we need to work with the issuers because they need to help us for all these activities. And also, it's important. And also the important role that they play. Thank you very much. We'll do the same. I've taken note of all the questions, but they are not that related to the specific topic, so they will be sent to the panel members. Thank you very much, but there are some interesting questions for Semarna on the wildlife. And it says, which have been the parameters that you estimated to consider the bioindicators or primary species for potential myiasis? And how frequent the monitorings are, for example, of carnivore mammals in order to have good bioindicators?
Hola, ¿qué tal, doctora Rocío?
Hello, Dr. Rocío. Thank you. So answering the question, it is according to the management programs we have. There is one area that gives us the information for us to do this type of evaluation. And as we said, most of us are starting to see the first phase of prevention, promotion, and all this. So we need to deepening in other matters to give concrete data. Okay, I'm going to stop the questions here. Octavio, anything pertinent that you would like to read, or do we stop here to give room to Alejandra? No, I want to thank the space, the opportunity to talk about the different topics. Just to reinforce Dr. Alcázar comments, in Senacica, we know that in Chiapas there is an important task of follow-up to assess the performance of the inspection at the origin and the verification activity in the points. This is good, and we want to congratulate Senacica for this initiative. Perfect. We also have the request or the proposal of Carmen to support the request. Lopez included a message meaning that they are available for the certification and to support any task conducted by Senacica, and that AICA is supporting in dissemination, training, prevention. But in these other activities at the field level, we have all these government organizations and other professionals, biologists, NGOs. So, Semarna, the public health part, I'm very pleased that you're always present. I repeat the commitment and the support of AICA for the activities, training, promotion, dissemination. You can count on AICA to support them. Engineer Alejandra is here. so you can count what we're doing at the regional level. Alejandra, I would like you to go to the concluding remarks. I also want to thank the staff that has helped to make this event possible. Mariana, our interpreters, Adriana from ICTs. Thank you. Go ahead, Alejandra.
Muchas gracias, Rocío.
Thank you, Rocío.
Un agradecimiento
Well,
muy grande a
our
cada uno de los expositores
warm appreciation to the panelists that have shared their experiences,
reflexiones también
reflections.
cada uno de los
We took note of each element that you consider pertinent.
entre ellos lo acaba de señalar Rocío, el tema
Rocio mentioned this,
más profesionales, el trabajo
the intervention of professionals,
con el tema del control de los perros de la calle,
the stray dogs, rangers,
tema central de que los animales no solamente son para el consumo,
and the animals not only for consumption, but they represent livelihoods as well.
cumplido los objetivos que están marcados por la oficina de
So we have fulfilled the goals marked by ICA Mexico office in opening this dialogue.
el último
And this is not the last space. We will gonna develop face-to-face activities and for follow-up of the topics that were comprehensively discussed today. I believe we can get out of the speech to focus in operational plans. Very important indications mentioned today we can run in working plans for 2025. So probably with Rocio, we're gonna try to have a coordination meeting with you and to organize some activities for next year. We are really committed with the cooperative work to add more stakeholders to have all this task, as we say, all together against the screwworm. Thank you so much. Thank you, everyone. We hope to see you soon. So we're going to have continuity with our panelists. We're going to continue in contact. We took note of your questions. We're going to try the material will be available in our webpage. We have commented with Alejandra the convenience to have a webpage for this or a specific site in ICA's webpage for this. I know we have Senacica support, the Secretary of Health, Dairy Products, and OHEF, to disseminate all this material that is being produced and that you have access to it. Thank you so much. See you in the next webinar. Thanks, Alejandra. Dr. Masitelli, thank you so much. A big hug to Italy. Thank you. Bye-bye. Thanks to our colleagues of the Wildlife Conservation Society, Semanat. Thank you, Carlos.
Doctor Oreamuno, gracias.
Sí,
Abrazo.
he saludado a José Joaquín con mucho gusto. Abrazo.
Igual, Leonardo.
Un abrazo. Un gusto. Abrazo
estamos
grande. Adiós.
en contacto.
Dale.
Gracias a
Keep
ustedes.
in touch.